Welcome to the CereCore podcast, where we focus on the intersection of healthcare and IT. From practical conversations to strategic thought leadership, let's unpack the decisions, challenges, and journey of those whose purpose it is to deliver technology that improves healthcare in their communities. Alma Alexander began her career in healthcare more than 20 years ago as an external and internal auditor and has served as the Chief Financial Officer at Cuero Regional Hospital since 2017. Before joining Cuero, she managed the financial operations and process improvements as CFO at Integrated Regional Laboratories, a reference laboratory owned by HCA Healthcare. She has held leadership positions at hospitals in several states, including Vice President of Finance at Sunrise Hospital in Las Vegas, Controller at St. Lucie Medical Center in Florida, and other finance roles at Raleigh General Hospital in North Carolina and Centennial and Skyline Medical Centers located in Nashville. Alma graduated the University of Alabama with a degree in commerce and business, specializing in accounting, and is a CPA. Alma serves as treasurer on the board of directors of the Cuero Chamber of Commerce and is an active member in her community. Alma, welcome to our podcast.
Well, thank you, Phil. Thank you. I'm very excited and happy to share these moments with you.
Well, just thrilled to have you with us today and really look forward to our conversation. So, maybe we'll just dive right in. Mentioned that you've been in internal and external audit and now the CFO at Cuero Regional since 2017. How did you get started in healthcare finance?
Well, healthcare is something that I've always been interested in, even growing up, and I decided that being on the side of medicine where you see all the blood, it was not really something for me.
Understood.
Yeah, but I did find accounting in the 11th grade in high school, believe it or not. I was introduced to that and I was like, wow, that's something that I could use to work in the healthcare industry. And so I attended the University of Alabama and majored in accounting. And from there, it started where I was working, like I said, an external audit firm. We did community health center audits. And I got a chance to go into community health centers later on. And then from there into the internal audit space, worked at the University of Alabama in Birmingham, internal audit with the hospital and the school. And then when I moved to Nashville, I was an internal audit with a local hospital organization there in Nashville. But then I ended up moving to Centennial. And from there, it started from there as a senior accountant all the way up into where I am now.
Wow.
Yeah.
Oh, that's fantastic. It's quite a journey. And just, I love the fact that early on, you kind of had a passion and a heart for healthcare and really kind of tried to figure out, hey, how can I play a part in that? Even if I don't want to be drawing blood or doing all of those other sorts of things, which
exactly.
There are a few of us that are called to do, but certainly understand. So, maybe if you wouldn't mind, are there a couple of call outs from your career, just kind of favorite highlights that you'd love to share with our audience?
Sure. Well, I can tell you that being here in the rural space and also working in community health centers, you find that healthcare really is a place where you need a heart to serve. And you're serving people that you see on a day-to-day basis. You may go to church with them. You may see them in the grocery store. And it is really, it makes me feel good as a person that, like I said, I have a heart to serve. And so it really helps to be able to be in a situation where I know that we are helping people daily. And it's a part of a team. From the front door, from our patients being checked in, to them being given service, to at the end of the day, collecting dollars that we can turn around and give that money back to the service of our community. So those are some of the things I think that really stand out to me in this world.
No, indeed, indeed. And I'm curious. You've walked the halls in dozens of hospitals, from Las Vegas to Florida to Raleigh, Nashville, and now Cuero, Texas. What might surprise our listeners about the financial operations of a reference lab versus a metropolitan hospital versus a rural health system?
Right. Well, it's very interesting that there are some things that are similar, and then there are definitely things that are different. The similar things are, I mean, you're looking for revenue, you're taking care of costs and making sure that you're keeping your costs in line, whether it's the lab or the hospital, large hospital or small. The big difference with integrated regional laboratories at the time when I was working with them, it was more of a cost center for the hospitals. And
Mm,
so we did have revenue that would come in, some local revenue, but it mainly was really about controlling costs. You weren't on site as on a day-to-day basis, but all of the work was coming into the lab and making sure you're managing it and you had people there. And then the big thing was the equipment there more than
mm,
anything, of staying on top of leases and things like that. That was something that was a day-to-day thing. And then you move to a large hospital where that is more about, it's all about staffing, it's all
mm.
about, what services are out there, it's the conversations with the physicians and things like that. And it's a lot of people. There's a lot of things to manage in a larger facility. Um,
Indeed.
and and the thing that was different about that coming to a smaller hospital, we do some very similar things. However, you have a lot more people in that larger facility that help manage everything.
Mm.
And it's kind of siloed, right? Whereas
Right.
in this environment, in a smaller rural hospital, people wear many hats.
Mhm.
So you can do certain things in this environment that you wouldn't have to do in a larger environment. But it's the same thing with keeping up with revenue and making sure that you're controlling cost for
Mhm.
sure.
Yeah. Well, and it seems like, in the rural space, you seem to be a lot closer, right?
Yes.
To the caregiving, to that inpatient. You mentioned it earlier, and I thought, you did such a nice job of kind of correlating the fact that, this is you're in the community. You're not removed from it. It's easy to get lost when you're in a metropolitan city of, a million plus, but
Yes.
when you're in a local community, you're right, you can't get lost. And so, I think it really kind of drives home, that mission, like you mentioned. So that's great to hear.
Yes.
I think there's, the hot topics for CFOs and CIOs. I think sometimes they can be different, right? From a healthcare perspective, and so I was just kind of wondering, what are some of your toughest challenges, as a CFO?
So in the rural environment, it really is about volume, how
Mhm.
many patients we have compared to a larger facility, and also the payer mix. So you've got more Medicare and Medicaid patients than you would other patients. So that can put a strain on your revenue. Uh,
Mhm.
we are as the hospital that we're in here, we are actually a taxing district. So we can tax, and so those dollars help support the facility. In that we take care of our charity patients as well as we have monies to maintain our building and our capital campaigns that we have. So, and there's also a medical foundation that we have that's kind of an arm that helps raise funds as well to be able to provide either new equipment or things like that for the hospital so that we can serve the community. That's one of the big differences between a small rural facility versus a large metropolitan organization, where that is mainly all about the revenue that comes in from seeing the patients for the most part. And you've got payer mix that's a little bit better than what we have, and the
Indeed.
dollars come in higher. So that challenges us with making sure that we manage all the dollars that we have. and that we have plans in place to make sure that we have a capital campaign. What is it that we need to purchase? What do our directors need to do their jobs day to day, and the people at the bedside? So those are some of the challenges and the things that we face. Very similar to the larger hospitals, but also very unique in the fact that where our revenue comes from. Even grants, we write grants to help take care of to cover costs as well. So.
Oh, indeed. Yeah, and it's interesting. We hold a lot of sessions sometimes with various groups of CIOs, and inevitably one of the topics that always comes up are some of the I wouldn't necessarily go so far as to say challenges, but some of the differences when it comes to CIOs and CFOs and how they communicate together. And there's so many different things that CIOs are paying attention to right now, whether it be AI or automation or cybersecurity, consumer-facing technologies, portals, the EHR, moving to the cloud, technical debt, the list goes on and on.
Yes.
From a CFO perspective, do any of those sort of topics, catch your eye? And if so, why do they grab your attention?
Yes. Well, I mean, although that's a lot of things you just named.
Indeed.
And I do keep up with the IT world. My husband is in IT, and so I find it very, very interesting and how it helps in the medical field all the way around. So that's one reason that I do stay interested in it. But from a business perspective, in the environment that we're in right now, and especially where we are in this rural area, the technology has really helped us. For example, cardiology, for inpatient cardiology, we don't have a big business where you have a cardiologist on site. So we have telemedicine where our doctors actually can take care of patients in the bed away, and they're in another city.
Sure.
So that is something that's big, and it's definitely helped rural hospitals across the country. And we use that service. We also use it in our clinics in particular, psychiatry, where it's very hard to find that in a rural area. So that's one way that I see how it can definitely help care for patients. Same thing with our stroke in our ER. We have support there on that. So then when it comes to IT itself, all of the networks that we have to have that communication set up, that's very important, and it's very important to stay relevant and stay in today. Like right now, we're going through changing our EHR, and that was from an old system to a newer system.
Right.
That newer system should bring to us more efficiencies and being able to, get the work out faster, and also provide information. Right now, it's hard to pull information out of our systems. Those older systems are not as easy to track stats and things. So it's trying to pull those stats out. So that can help us make decisions for our future. If we have a strategic plan, how do we know what to look at if we don't have that great data? And so those things are things that I see are very needed in rural environments, in smaller environments, and of course they're needed in larger environments too, but here in particular, we do need that to be able to make decisions from. And I would say some of the things that I see that maybe AI could help us with are things going forward are what kind of type of bedside care can be done through that world. Also, what can it do for us from like a case management perspective or HIM perspective or even accounting? Those are the types of things that I have started to kind of look at from my perspective and going into the future, and how do we plan for those things?
Oh, that's fantastic. I appreciate the insight there. And maybe we talked a little bit about some of these. There's a variety of projects. When IT comes to leadership and says, "Hey, listen, there's this investment we need to make from a technology perspective." And you touched on a little bit, but maybe if you could, just summarize, what is it that the CFO of a hospital or a health system is looking for from that CIO when it comes to that investment request?
Yeah. So one of the things in working with our CIO, when she came on, we were looking to update our system and then hopefully go into a new EHR. And so having a conversation with her about, what are the needs? How far behind are we and what do we need to do to get it there? And so as a part of our strategic plan, as an organization, we've worked together. Every year we do a strategic plan, and it usually lasts from anywhere to 3 to 5 years, and then each year we update it. And by using that strategic plan, we were able to make sure that we were financially ready for it, but also working with our CIO and telling us what we needed to update, what type of rules that we need around it, cybersecurity things that we needed to do to make sure that we were taking care of our system and keeping it safe. And then, just like, what's the return on investment? How do we come up with how it's going to assist our organization? And just really relying on her and her expertise to be able to kind of guide us through what we needed to do in the organization.
I think that's great insight. I think so many times, depending on the maturity of the organization, tying in, the CIO or IT director, whatever level you happen to have, sometimes they're not privy, unfortunately, to some of that strategic planning. And I think it's just so critical, and it's a miss for organizations that don't include that top IT executive into those conversations, because, how in the world can they properly execute if they don't know? And so, I think I love your insight and perspective there. It really does go back to that strategic plan. And then how do you, as a leadership team that encompasses the CEO, that encompasses operations, that encompasses clinical, CFO, CIO, how do you all together work to make sure that you're making the right decisions to move the organization forward and to achieve that? So I think that's great perspective. I appreciate it.
Yes, you're welcome.
So you'd mentioned that you all are embarking on an EHR upgrade and in modernization program, and those are no small feat in and of themselves, to say the least. And certainly a lot of work that goes into those, variety of phrases from pre-planning to post go live. Perhaps share with the audience, are there any kind of tough decisions that you've had to make so far, along the way, or, key or critical conversations you've had to have with other leaders inside of the hospital, the board? Any pivotal moments yet?
Yes. Well, the big pivotal moment happened it's about 2 or 3 years ago of determining what system we were going to go with. And then pulling together that budget to present to board. And the board, and asking questions, and then being able to answer all of the questions that they had, and to get them to understand how it all works, especially now with changes in the way that you book equipment and software service and all of those types of things. So all of that came into play. We were able to get their approval. And one of the things that we made sure that we had some contingent cost in that, and made the board aware of that, because when you're doing this, it's bound to pop up that you're going to need additional services or maybe new equipment, or this old system did this type of process, but now you're going to need a new software as a service partner to do something different. So we made sure that we included those types of things. And the pivotal things now is we have a team that's really ready and willing to do the work, but we still don't have enough hours. So those are some of the things that we'll have to plan on stepping out and getting additional help on that.
Yeah.
So those types of things are just staying on top of where we are in the process and what's needed.
Indeed.
And it's great to see that our team is really engaged and that they want to do the work. When we just did some testing and not just bringing our directors in or the people who were doing the bill, we also brought people who work the front line and let them see how it works.
Yes.
So those types of things that we've been able to, those are pivotal moments to me.
Yeah, well, indeed. And I know certainly, from a leadership team perspective there, making sure that the whole organization, knows the why, right? And is excited about the why and what that ultimate end goal is going to be is certainly critical from that standpoint. You all have done a wonderful job of that. So, from your perspective, as the CFO, what will success look like for the Expanse implementation?
Okay. Well, first of all, I do want to say that, of course, patient safety, that's my number one concern. Like I said, that hard to serve. I want to make sure our patients are safe when they walk in that door. And I feel that having this newer system of being able to get all the information that's needed, being able to trace it throughout from our clinics all the way through the hospital service, it's just going to be all on the same platform and great for us. And then ultimately, as the CFO, I'm going to go back to, are we dropping all of our claims and getting all of our revenue in?
That's right. Yes.
Yeah. So, I mean, I wouldn't be a CFO if that was not my...
That is exactly right. That is exactly right. No, that makes perfect sense. It's so critical regardless of whether you've got a major, EHR project going on or not, but, and that's communication and alignment with the leadership team.
Yeah.
So, maybe if you wouldn't mind sharing with our audience, just kind of how, you've chosen to do that as a leadership team, to keep that alignment, to make sure that, what you're doing on a day-to-day basis, on a project basis, just makes sense and stays in alignment.
Right. Well, communication is key. We are all on the same page. We communicate a lot via text. We have teams. We're talking to each other that way. But it's also a structure. Like I said, we start with that strategic plan.
Yes.
And we approve it through our board, and the board is on board. They know what's going on. And then on a weekly basis, we have a team meeting that we call SLT meeting. And it involves not just our leadership, like CEO, CFO, associate administrator, and CNO. We also have other directors that come in, including the CIO. And we go through, where are we with that strategic plan, and then day-to-day things or projects that are going on, and do updates on those. All of us have direct meetings with our directors, all of the people that report to us. We do monthly, if not more often, meetings, and we encourage and require our directors to do one-on-ones with their staff members as well. And then one of the other things that's very unique that I think that is maybe the size, but I think it could be done anywhere. Our CEO does a meeting every quarter, just about every quarter. We'll do all hands on deck. Everyone has to come to what we call, I've forgotten what the call. It's like it's a meeting where all the employees have to come and they listen to an update. We give a financial update. We give, some of the things that we're working on, and then we give the things that we'll be doing, like Hospital Week. We'll give information about that. And we hear back from our employees. And there are different times throughout that week where you can come early in the morning or come in the evening or in the middle of the day, and we give information to our employees. And I think that really makes the difference in being able to roll out projects or make sure that we're keeping our patients first, that we are actually having those conversations, not just amongst the senior team, but also all the way down through the entire organization.
It's just that alignment, so many times we talk about it in the context of, a leadership being aligned, but at the same point, you have to then share the result of that alignment with the rest of the organization in order to get to where you need to go from a strategic goal standpoint. So I think that's fantastic in that regard. Well, Alma, I really appreciate your perspectives today. We always like to wrap these up with just kind of an open-ended call. If there's anything that we haven't touched on today that you think, kind of words of wisdom, so to speak, that, anything else that you'd love to share with our audience, as we wrap this up that we haven't touched on today.
I don't think that there is anything we haven't touched on, but I can just say, I guess, in this field of healthcare, I say, keep your patient first. That's always going to make or break you. If the patient's not first, you're not in the right business. And I like to say, hire and encourage staff to have a heart to serve, and always to keep that, as their front of mind. Yes. Communication is key to success. You got to communicate, and then just not only have a plan for today, have a plan for your future too. So with your strategic plans, make sure that you're covering staffing, that you're covering equipment, that you're covering what do you do with your plant? Are you taking care of that type of thing, as well as taking notes from your people? What are some of the things that they're interested in, and what can we do to help grow the organization?
No, I think that is a fantastic summary and wrap up. So, now, Alma, greatly appreciate your time today. Appreciate your partnership. Appreciate your heart for healthcare. So, thank you very much.
Thank you. And I enjoyed it. And I wish everyone peace and happiness.
Amen to that. Thanks for listening to the CereCore podcast. We hope you enjoyed this conversation. Follow us on your favorite podcast platform for more episodes. Connect with us on LinkedIn. Visit our U.S. website at CereCore.net. And for those abroad, visit CereCoreInternational.net. Learn more about our services and find resources. At CereCore, we are healthcare operators at heart and know the difference that the right IT partner can make in delivering quality patient care 24/7. Let's help make IT better. Here's to the journey.